We don't know. There's always a risk, and we don't know how much of a risk there is. So I think we are hopeful that the phase 3 trial result will be supportive of the use of the vaccine. But yes, that is absolutely true. There is always a risk that the result will not be very good, and then we cannot use this vaccine. That remains to be seen, Beverly.
Yeah. Interestingly enough, of course, China is rolling out. That's where its origins are. It is rolling it out extensively. But this company has had issues raised with its processes in the past. What can Indonesian authorities do to make sure that those boxes have been ticked?
Thank you. So I think the government had done their best to ensure that these processes are done according to the regulations. So I think last month, the Indonesian authority, local FDA, and also the Indonesian Ulama Council had visited a Sinovac factory in China, and to make sure two things: that that they follow the good pharmaceutical development practices, and then also to ensure that the processes are halal according to the Islamic regulations. So I think they did that. At least the Food and Drug Authority had declared that the processes are, using your terms, all the boxes are checked. And I think they also said that the processes are according to the Islamic rules.
That is interesting that we hadn't necessarily thought of that being halal, which is fascinating because that would apply to many, many countries. Who will be the first to get these vaccines, and when might they start rolling out across the country?
Yes, so I think the plan is to provide the vaccines to healthcare workers and other workers working at healthcare facilities providing direct care to COVID-19 patients. And I think the government is planning to roll out the vaccination program in February, early February. But I think the principle is to wait for the emergency use authorization to be issued.
Yeah. Realistically, this number of inoculations is a drop in the ocean for a country the size of Indonesia. How concerned are you that people will start relaxing given the scope of the pandemic in Indonesia?
Indeed, Beverly. I think that already happened. I think people are already relaxing even before the vaccine is being used. So yes, but that is absolutely true. So the two things. So we have only a very small number of doses in the beginning of the program, and it's only targeted to medical workers, healthcare workers. So meaning that will have very little effect to stopping the pandemic in Indonesia. Probably it will have, hopefully it will have some effect to protecting healthcare workers, but absolutely there is very little effect to stopping the pandemic. And yes, we are worried that the vaccine will give false sense of security. And that's why I've been advocating, and I think all the epidemiologists have been advocating that these vaccines should not be considered as the silver bullet. And then we need to be disciplined and practicing all the health protocols, wearing masks, keeping social distance, and other things that are necessary to keep the pandemic in control.
Mm-hmm. What are the expectations of how it might, if these vaccinations are successful and these programs are successful,